On November 20, 2024, the CDC made a surprising change to its website, shaking the trust of many who rely on its health guidance. The CDC has long been a trusted authority for parents and doctors, especially regarding vaccines. This update, however, marked a dramatic shift in the agency's stance on the relationship between vaccines and autism. For years, the CDC's website firmly stated that scientific evidence showed no link between vaccines and autism. The new language was not a minor tweak. It was a significant departure from the agency's established position. The change came amid intense political debate and after the confirmation of Robert F. Kennedy, Jr. as Secretary of Health and Human Services, a figure known for questioning vaccine safety. Many see the website update as a direct result of these political developments, highlighting a growing tension between science and politics. The CDC's guidance shapes decisions for families, doctors, and public health policy, so when its message becomes unclear, it can create confusion and fear. This uncertainty risks undermining public confidence and could lead to choices that endanger children and communities. That's why it's crucial to examine what changed, why it changed, and what the science actually says. So, what did the CDC actually change? The website now states, the claim vaccines do not cause autism is not an evidence-based claim, because studies have not ruled out the possibility that infant vaccines cause autism. This is a stark reversal from the CDC's previous unequivocal stance. The headline still reads, vaccines do not cause autism, but now there's an asterisk, leading to a note that the headline remains due to a Senate agreement. This creates a confusing contradiction. The headline says one thing, the body text says another. Such mixed messaging undermines the CDC's credibility and leaves parents uncertain. Experts argue this change wasn't driven by new science, but by political pressure. The Department of Health and Human Services defends the update as transparent, but medical experts say it's misleading and ignores overwhelming scientific evidence. The result: a trusted health authority now sends a muddled message on a critical issue. To understand the change, we need to look at the politics behind it, specifically Senator Bill Cassidy, a Republican doctor from Louisiana. As chair of the Senate Health Committee, Cassidy played a key role in confirming Robert F. Kennedy, Jr. as HHS Secretary, despite Kennedy's controversial views on vaccines. Reports say Cassidy's support was secured by a deal. The CDC would keep the "Vaccines do not cause autism" headline on its website. The intention was to protect the scientific consensus, but the compromise backfired. While the headline remains, the new contradictory text beneath it undermines the message. The spirit of the agreement was lost, leaving the public confused and the medical community alarmed. This episode shows how political deals can distort scientific communication. Senator Cassidy tried to balance his roles as physician and politician, but the result satisfied no one. The CDC, caught in the middle, now sends mixed signals on a vital public health issue. It's a stark reminder of the risks when science is subject to political negotiation. In response to the controversy, Senator Cassidy publicly reaffirmed his belief in vaccine safety. He stated, "Vaccines for measles, polio, hepatitis B, and other childhood diseases are safe and effective and will not cause autism." Cassidy called any statement to the contrary wrong, irresponsible, and actively makes Americans sicker. His remarks aim to restore public trust and counteract the confusion caused by the CDC's update. When pressed about his vote to confirm Kennedy, Cassidy avoided direct regret, focusing instead on reassuring the public. His position highlights the tension between scientific integrity and political compromise. Cassidy's strong words support vaccine safety, but they now compete with the CDC's official confusing message. Many in public health appreciate his stance, but worry the damage is done. The CDC's mixed message may carry more weight than any senator's reassurance. The medical and scientific communities responded swiftly and forcefully to the CDC's website change. Doctors, scientists, and major organizations condemned the update as a dangerous step backward that promotes debunked theories. The American Medical Association and the American Academy of Pediatrics reiterated, vaccines are safe, and there is no link to autism. Autism advocacy groups called the new language anti-vaccine rhetoric and outright lies, warning it stigmatizes autistic individuals and their families. Even former CDC officials expressed alarm, saying the agency's credibility is at risk. The backlash was unified. This is not a debate between two equal sides, but a case of established science being undermined by politics. Experts fear the CDC's new message will fuel misinformation and erode public trust. The scientific consensus is clear, and the CDC's shift threatens decades of progress. The response from the medical world is a call to defend science against political interference. The stakes are high for public health and trust. The idea that vaccines cause autism has been studied for over 2 decades, and the evidence is overwhelming. There is no link. Massive studies from around the world, involving millions of children, have all reached the same conclusion. For example, a landmark Danish study followed over 500,000 children and found no difference in autism rates between vaccinated and unvaccinated kids. Reviews of dozens of studies, including a 2015 analysis of 1.25 million children, confirm these findings. Concerns about thimerosal, a mercury-based preservative, were also thoroughly investigated. No connection to autism was found. Removing thimerosal from vaccines did not reduce autism rates. The CDC's new language ignores this mountain of evidence. Experts note that while science can never prove a negative with absolute certainty, the data here is as strong as it gets. The scientific process has answered this question. Vaccines do not cause autism. The CDC's update contradicts decades of rigorous research. Why are scientists so confident? Because they've used powerful methods to study vaccines and autism. Large cohort studies track vaccinated and unvaccinated children over years, consistently finding no difference in autism rates. Concerns about vaccine ingredients, like aluminum, have also been debunked by major studies involving over 1 million children. The infamous 1998 study that sparked the scare was retracted for fraud, and its author lost his medical license. Studies suggesting a link are often small, flawed, or misinterpreted. In contrast, the evidence supporting vaccine safety is vast, high quality, and repeatedly confirmed. Experts criticize the CDC's new page for citing weak studies while ignoring the strongest evidence. This cherry-picking undermines good science. True scientific practice means weighing all the evidence, and it overwhelmingly shows vaccines are safe. The conclusion is clear. Vaccines do not cause autism. The CDC's website change isn't just about words, it has real consequences for public health. High vaccination rates protect communities through herd immunity, shielding the most vulnerable. When trust in vaccines drops, even slightly, diseases like measles can return. Recent years have seen measles outbreaks in areas with low vaccination rates, reversing decades of progress. The CDC's mixed message may increase vaccine hesitancy, putting more children at risk. Parents confused by the new language may delay or skip vaccines, endangering their kids and communities. Public health officials now face a tougher battle to communicate the importance of vaccines. Leaders from both parties, and physician governors, have spoken out. Vaccines are safe. Misinformation is the real threat. The CDC's change fuels that misinformation, undermining efforts to keep people healthy. The stakes are not theoretical, they're measured in lives. In a world full of information and confusion, it's more important than ever to trust science and evidence. The CDC controversy has made things harder, but the scientific process remains our best guide. After decades of research and millions of children studied, the answer is clear. Vaccines do not cause autism. This consensus is shared by the world's leading medical organizations and built on rigorous, repeated studies. We must support public health agencies that provide clear, evidence-based guidance, free from political interference. Healthcare professionals, pediatricians, family doctors, nurses, are trusted resources for families. Vaccinating your child protects them and your community, building on a century of scientific success. In the face of confusion, let's choose to trust the overwhelming weight of evidence. Let's listen to the experts and make decisions that protect our children and communities. Science, not politics, should guide our path to a healthier future.